The key advances in lung cancer, I would say, are immunotherapy nowadays. So we have lung cancer as an example where immunotherapy with immune checkpoint inhibitors works, improves survival, both in pre-treated patients and also recently shown for patients who have not received any treatment with advanced non-small cell lung cancer. Of course, in the advanced setting, they should have the expression of the PD-L1 in 50% or more of the tumor cells. So we have immunotherapy. We have also targeted therapies, and this is also a major topic at this conference. For example, we'll have a trial that looks what is the best treatment after you progress under treatment with the first or second generation EGFR tyrosine kinase inhibitor. The question is, do you switch to chemo or do you switch to a third generation EGFR inhibitor? And based on the press release, it has been shown that switching to the third generation EGFR inhibitor is the treatment and choice in the future, is superior to chemotherapy, and so this will be a practice-changing presentation. We have also a presentation on the role of radiotherapy in patients with brain metastasis and EGFR receptor positive disease. So Professor Wu from China will present a randomized trial that compares EGFR tyrosine kinase inhibitor icotrokinib versus treatment with radiotherapy in patients who have brain metastasis. So I'm looking forward to this. And this will also potentially have a practice-changing treatment in the way that patients might be treated, patients with mutation-positive disease and brain metastasis might be treated with EGFR tyrosine kinases, and radiotherapy to the brain might be withheld in this patient. So I'm looking forward to the presentation of this trial. So, and then of course we have also advances in combining the various treatments. So we have stage 3, we have chemoradiotherapy plus minus surgery. In the adjuvant setting, of course, we have surgery followed by adjuvant chemotherapy, and what's ongoing there is now to look into targeted therapies, whether they can improve survival or cure rate, particularly in patients who have EGFR activating mutations. Then we have also trials ongoing with immune checkpoint inhibitors in the early stages and the local advanced, where cure is the main goal. So we'll see whether the treatments that prolong survival in the metastatic setting will have an impact on the cure rate in early disease stages. So this is treatment. In order to provide the exact treatment, you need to have an exact tumor stage and the molecular analysis. So staging the new DNM classification, the ACE DNM classification, is a major topic because it will be implemented next January. Then also molecular analysis, particularly in clinical practice, what is standard, what are upcoming targets that you assess in routine practice. And another important topic, of course, is liquid biopsy. So can you find these genetic alterations of tumors also in the blood, which is much easier accessible. So liquid biopsy is an issue, and particularly, of course, predictive biomarkers is a major issue with all the treatments. Can you define those patients who have the greatest benefit from a specific treatment? And there, of course, molecular biomarkers of great interest. And I just refer to the importance of biomarkers with regard to immune checkpoint inhibitors, and this is a major topic here also. A lot of discussion is ongoing, which patients should receive treatment with these new immunotherapy approaches.